Welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday, nurse practitioner here at Revitalize MD, and today we have a fun podcast.
Hip dips.
Why do we have them, right?
Yeah.
What are they? Why do we have them? How do we get rid of them? Can we get rid of them?
Yes, all the things
What
about
are
hip
our
dips.
options, right?
Well,
That's
and
the
again,
question.
I don't think I even really realized what they were because I didn't have them. I really wasn't searching. I did have them, but I wasn't searching about hip dips.
That's
Then in the first training for like booty filler treatments, I figured out how important hip dips are.
Yeah.
And sure enough, if that's not addressed on almost a daily basis here.
It's crazy how something that's naturally occurring in the body for some medical professionals we just don't think about until someone goes, hey, I don't like that. What do I do about it? And then we look for solutions, find them, and treat, right?
And really, when we're doing a booty filler treatment, and we have done other podcasts and YouTubes on that. So again, like and subscribe, and so that you get all notifications when we do a podcast or a video. But basically, some women are okay with their hip dips. So it's definitely important to ask, do you like your hip dips, or are we going to address that with the filler treatment?
Again, because it's naturally occurring. And some women like the way they look. Some don't.
Yeah.
Just like some women want a bigger booty and some don't.
Yes.
It's just your preference.
Well, and I definitely think that this is a time when bigger booties are in.
That's it.
You know,
we like big butts.
You've heard the song. And so again, we hear that on a frequent basis. So again, when we're talking about hip dips, we're talking about that indentation, like below the hip bone and prior to, like, you know, the upper part of the thigh.
Yes.
And again, it's an anatomic finding that is normal.
Yeah.
And
it's based on your genetics.
Yeah.
And it's based on the shape of the pelvic bone.
Yeah.
That's it.
Yeah.
Now, can some things make it more drastic than others? Yes. So weight distribution definitely can make a difference.
And some women get it more when they work out. And again,
exactly. So muscle mass.
Yeah.
Yeah.
And again, that genetic, you know, and anatomic is, so there's really nothing you can do about it if your genetics and your anatomy are making it up. And so some women, it becomes more prominent. So they come in very fit with big hip dips and they don't like them. Yes. And so again, what can we do to get rid of them? And if you look for solutions on Google, what you get are exercises.
Yep. They tell you lunges, donkey kicks, squats, which is great. But as Dr. Durst pointed out, for some women, the more lean muscle you have there, the more prominent those dips are.
Well, and I think, again, like as I started to do more buttock exercises, it seemed like mine were more prominent. So again, a genetic and anatomic thing. And if you don't like it, there's really only one way to correct it. And again, well, there's some other more extreme ways.
There's really
surgical
two.
corrections.
There's surgical and injectable. That's really kind of what it comes down to. Other than diet and exercise to see if you can, if it's a weight distribution, losing some weight can help.
Yes.
Sometimes it can help with exercise, just not always. For some women that exaggerates it. So there's diet, exercise. That's kind of on the list always at some point for any medical process. But on the aesthetic side, surgery side, you're looking at an injectable option or a surgery option. Yeah. We don't do surgeries here. We like more natural medicines and more natural
if you're
options.
doing like a fat transfer, that it's not as big a deal, but like a Brazilian butt lift is like significant downtime because you can't sit on the butt, you know, when you're actually, you know, healing from that. So this is an in-office, like 1 hour procedure that is minimally painful. We personally use a cannula with that. And again, there's a couple different fillers you can use, but those are biostimulatory fillers. So really those two biostimulatory fillers we're talking about is Radiesse, which is one of my favorite fillers, or Sculptra. And those are the two. And like
we use Radiesse here.
We use Radiesse. And again, we have other podcasts and YouTube videos that talk about the difference between Radiesse and Sculptra.
And why we prefer one over the other. Correct. So please listen on to learn more about that.
Because that's important, because a lot of women, a lot of offices tend to use Sculptra, and there's reasons why I would, and they're solid, definite reasons why I prefer Radiesse. And so that's what we use in our booty treatment. And again, it can be, just at one time in the office, but you're getting a significant amount of biostimulatory filler placed at that time. And again, it depends on what your desired results. But with this, we're talking about hip dips. So we're talking about, on the side of your, filling that in
and
so that you don't have it. Yeah.
That contour, making it more round or flatter, kind of whatever it is that you're looking for. So it's really important to go to somebody you trust, that you jive with, that you feel is actually listening to what you want. Because what we may think and what you may think look good are two different things. We want to make sure we know what you want. Do you want a rounded look? Are you looking for it just to be filled, to be flat?
Yeah.
What are we looking for? That way you're happy with the results as much as we are.
And when some people want a cellulite treatment on the butt, or some people want a lift, but they like their hip dips. So you definitely have to have those conversations. They have to hear what you want and then be able to regurgitate that back to you.
Exactly.
So they understand what you want and then
I
can
like
give it
that.
to you.
Regurgitate it back.
You do not want to walk out with hip dips filled if that's not what you wanted.
Exactly.
And so anyhow, it does matter what you want. And so regurgitation is good.
That's it, right? So for me, I've got plenty of booty, but I wanted smoothing a texture, and I don't really have the hip dips because I've got a lot of booty. It all fills in.
Yeah.
Where others, like Dr. Durst said, the more she's worked out, the more she started to realize it. And she was like, hey, I do have these. Maybe we can fill these out. And I'd like a little bit more of a top shelf. Yeah. I mean, so everybody has different needs and wants when it comes to booty treatments.
And we can put a couple before and after pictures of hip dips and those filled out on the YouTubes, but obviously not on the podcast. So anyhow, again, the way to fill them out non-surgically is with filler and a biostimulatory filler at that. And then again, Radiesse is our favorite one.
Absolutely.
But also there's so many different things you can do with Radiesse in the butt. This is on specifically hip dips, but you can talk about texture and cellulite and booty fill all the way and make it round and get a big butt and all the things.
Top, bottom, sides, we can do it all.
We can do it all.
But we'll digress back to the hip dips.
Yeah.
So the surgical option is liposculpting or fat grafting, where they'll pull fat out of the one part of the body and then fill the dips in. But like Dr. Durst said, it's surgery. You have downtime. It's a longer process where you can come into the office, have virtually no downtime. Yes, you may have some bruising, but we're injecting quite a bit of Radiesse into the area, but it's done in an hour and it looks great and it lasts.
And it's not painful. So again, you need to know your options and available options. But again, for me, it's very simple. It's a no-brainer. There's one option and it's filling, especially for hip dips, because it's quick, it's easy, it's effective, it's painless, and it's done in an hour.
Done. And you go on with your life.
Done. It's easy. So anyhow, subscribe. Let us know if you have hip dips, what you've done. Have they improved? Have you had a filler treatment? We would love to hear.
What you've tried, what you've not tried. Yeah. If you've got a secret we don't know about, please share.
Yes, let us know. So again, let us know all the things, because we're here to revitalize your look, your health, and your sex life, and your booty.
Thank you.